Okay, this is Tim Gregory's persuasive speech on universal health care. The United States is the only industrialized country in the world that does not have a set universal health care system established as a citizen's right. However, in the United States, we also do not pay 42% in taxes like Denmark that comes straight out of their paycheck. These facts alone make it difficult to decide whether or not we need universal health care in the U.S. Although it would be great to ensure every citizen in the United States, there are many problems with having a universal health care system. This is why, despite past efforts, the United States currently does not have a universal health care system. In fact, there is a strong contingency of people against it. This is why I understand that just because health care would be universal does not mean that it would be free. There are many hidden costs. If health care were universal, income taxes as well as sales taxes would go up. In Germany, the overall percentage of taxes from their citizens pay from their wages is 54% in comparison to the United States, where we pay 29% from our wages. It would also be difficult to get an appointment to see a doctor in the United States because people would all of a sudden have health care. In addition, people would try and go into the doctor for every scratch or bump. Think about how long it takes to see a doctor now, even with a set appointment. Would the average American be willing to wait longer than that? In Canada, where they have universal health care, a study has been done at the Centre for Spatial Economics for the Canadian Medical Association reported patients waiting up to a year for a hip replacement, 30 days for an MRI, and 7 months for cataract surgery. Some patients even waited up to 3 months for a coronary artery bypass surgery. Besides the longer wait time, universal health care may also lower the quality of patient care because the doctors are too busy. If there was universal health care in the United States, then it is likely that the salaries of workers in the medical field would decrease. If the overall occupation for doctor starts getting more difficult, then it might make medical students think twice about going into the field. Moving from an individual health care would be a very painful transition for our economy. Since there would be no private insurance, many employees would be left without jobs. Hospitals and clinics staff that help with dealing with billing and insurance would be left without jobs. While a certain amount of these people would be able to get jobs within the new government system, it would not account for all the workers. This would increase the United States unemployment rate. Universal health care is very important. It would be a great achievement to be able to give everyone in our country health care. But right now, I don't think universal health care is a good idea for the United States, because I don't think the economy right now could handle losing jobs as well as inflation. Recently, our economy has been slipping into a recession, and we're already one of the most highly taxed countries in the world, and that problem could only get worse. And we're currently in a war But I think that after the war, it, it'd be easier to fund a universal healthcare system.